Here's how to talk about death openly and honestly. This isn't a conversation anyone wants to have. Doctors, nurses, people who work in healthcare, family members, people don't want to talk about it. So it's not talked about. People don't know how to bring it up. They don't know how to talk about it. So in this video, I'm going to explain to you how to talk about it. How I, as a hospice nurse who talks about it day in and day out, how I talk about it with my patients. Learning how to talk to someone about death plainly is going to help them make better decisions for their own life and plan for their death. As a healthcare worker who works in end of life, I do think it is a little easier for me to bring it up because people know I'm supposed to, right? But I will say that the more I worked in the end of life field, the more I realized most people are glad to finally meet someone who is willing to speak openly to them about their end of life. Just know that although it may feel very scary to do so, from my experience, most people are glad when they meet someone who is willing to talk about it. So first, you want to create the right environment. So it does have to be calm, and you do have to have some time, which is hard for healthcare workers because I know you don't always have the time. But you do want to try to create a space that feels calm and that you have the time to truly talk to this person. I always try to be gentle, but very clear and very direct. To me, this shows the person that you're discussing that you're comfortable with it. Now, if you can't make eye contact and you can't say the word death and dying or end of life, that gives them cues that like, oh, we're all uncomfortable here. So you need to be the pillar, the person who is showing them that you can look at them, you can talk about death and dying. You are comfortable with this conversation. You have the answers to their questions. Whether you do or not, we need to be open about, hopefully you can help with some of the questions they may have. So you start direct. You can be gentle and direct. Those two things can coexist. I always start out with saying, everyone has an end of life journey. One, because it's true. We all are going to have an end of life journey. And some of us will know our end of life journey and some of us won't. So I start out by saying we all have an end of life journey. Right now, we know that this may be your end of life journey. The disease that you have been living with or just diagnosed with, we know is life limiting, possibly terminal. So we know this could be your end of life journey. This could be it. This could be the thing that you will eventually die from. So in knowing that this could be your end of life journey, how do you want your end of life to look? If you could plan it, if it could be a certain way, what would you want it to look like? To me, this gives the person back the control. They don't have control over the fact that their life is ending. Unfortunately, they have this disease. It's likely going to end their life. They don't have control over that. That feels awful. But now if we think about it, it's a journey. They have the choice on how that journey looks. Where do they want to be? Who do they want to be with? Do they want to be on hospice? Do they want to continue treatment? They get the control back. They get to control their end of life journey. And that is what I try to convey to them. If you know what's happening, what do you want it to look like? And I truly have no agenda as far as being a hospice nurse. If they don't want it to be on hospice, that's okay too. What I want them to know though, is that they have a choice. They can plan about how this looks. So let's say they do decide. Let's say they say to me, I want to be home. I want to be comfortable. I want to be with friends and family. Let's say they say that, because nine times out of 10, they do. Perfect. That is how hospice can help you. Hospice can facilitate that for you. We can make it so you can live out the rest of your life. We can help manage your symptoms. We can help educate you about what your specific end of life journey will look like. For the most part, we see this day in and day out. We see a lot of the same diseases day in and day out. We can help you plan for how this disease will progress and how we're going to help you through it. Now, once you say that to them, they usually will start having questions. Okay, well, how is it going to look? What do I have to prepare for? What symptoms can I expect? And most of the time, the healthcare worker who has been seeing this a lot over the years knows, we know, well, there's usually some pain involved. You might start getting short of breath, so maybe we'll order some oxygen. I always try to let them know what I typically see and how we'll be able to help with that. Now, of course, you don't always want to do this all in one sitting. Sometimes it does happen all in one sitting. It kind of depends on the person and their family and how much time you have. You can't hit them all at once. But I think it opens the dialogue to help them understand that you are a person that they can talk to about this. You are comfortable with this and they can ask you questions, and it opens the dialogue to end of life planning. What it also opens it up to is the family hearing all of this happening. So now the family feels comfortable asking questions, and now the family might feel comfortable talking to each other about what's going on. It just opens the safe dialogue to help people see that talking about this topic doesn't have to be so scary. And in fact, it might actually feel comforting. You also want to make sure you talk about like practical matters, things that are really concrete. You can talk about all of the emotional things as well, because all of these things are going to come up organically as time goes on. But specific things are nice for people to hang on to, right? Give them that control back, because this can be a time in their life where they feel very out of control. So specific things they can do, filling out an advance directive, organizing or arranging their funerals, writing an obituary. These are not things that have to be done immediately, but a lot of times having tasks and knowing like what specifically needs to be done can be really helpful for the patient and for their families. Everyone's going to act differently. They're all going to react differently during this conversation, right? So some people might turn stone cold, right? They're defensive. They don't really want to hear this. Some family members could start crying. Some people could walk away. Not everyone's going to be okay with this. Now, I will say most of the time they're happy and relieved that someone's bringing it up, but every once in a while people get angry or upset that you're bringing this up. Please know that that's really normal. And when people say stuff like hold space, I'm going to hold space for this moment, that's what they mean. This is the time when you are going to allow people to have emotions. We are all human and we're allowed, and it's normal to have emotions when we're talking about stuff like this. So you don't have to say stuff like, don't cry, or I'm sorry I made you cry. You can just allow it all to happen. And actually you can even say stuff like, it's really normal that you feel so upset right now, or that you feel angry, or you could even call out the elephant in the room. Sometimes I'll have these conversations and I can tell the family is mad. The patient's okay with it, but the family's looking at me like, how dare you bring this up? We told you not to talk about this, something like that. I will even call the elephant out. I'll say, I think I've upset some of you guys. I can tell you guys are a little angry and upset that I've talked about this. Let me know. We can openly talk about all the things we're feeling. Even give them permission to say what they need to say, even if it is something that they're angry about. And lastly, but definitely not least, validate and listen to people's feelings. You do not need to make anything better. Even if they're saying stuff like, no, I don't want to die. No, I'm scared to die. You do not have to say, no. Don't be afraid. Don't be scared. You let them say things like that. You can even be honest and say, me too, if that's actually how you feel. It's about cultivating this space where they feel comfortable sharing exactly how they're feeling. And most of the time, by you just allowing someone to do that, you will be surprised by how much that helps. We always think we need to do something, say something, we need to help. Most of the time, by just letting someone feel how they need to feel, that helps. That helps. Talking about death in a plain matter gives people control back to something that they feel like they've lost all control.